Hi everyone, this is lecture 31 on the pathology of the urinary system. So in this very brief lecture, we're going to cover the major terms and major disorders that may be encountered in the urinary system. And this will conclude the final lecture in this section. So we'll cover some basic terminology and some clinical procedures associated with the urinary system. So the first one is nephrolithiasis, and here I've indicated the page number in Ammerman that if you want to read more about it. And this is just the clinical term for kidney stones, or also known as renal calculi. And these are precipitates of calcium oxalate salts, and usually they appear when the filtrate is in a very high concentration, and they are produced. Normally, they're very small and pass unnoticed. However, larger ones may remain in tubules and collecting system and block it and may be considerably painful, producing what's called renal colic. So symptoms include blood and urine, sweating, nausea, and vomiting. There are several ways of diagnosing them. One through computer tomography, which we mentioned earlier in the semester, and intravenous pyelogram, which is a radiograph that using a contrast medium such as iodine. Another disorder is called glomerulonephritis. As you know, it's any itis. This is some sort of infection, and this is damage to the glomeruli. Okay, and this inflammation of glomerular capillaries in its basement membrane, and as a result, there's an increased permeability, increase in the glomerular hydrostatic pressure, lead to blood and protein in the urine, and of course, this may lead to renal failure. So, what is renal failure? Renal failure is the decreased glomerular filtrate rate, which may result, in liver dysfunction. Maybe due to decreased blood flow to kidneys, kidney disease, or urine obstruction. Diabetes mellitus and hypertension are also risk factors. Uremia. When the GFR is 50%, this occurs when the glomerular filtration rate is 50% normal, and it can be characterized by buildup of waste products, fluid and electrolyte, and acid-base imbalances, and this may require dialysis. Dialysis. There are two types of dialysis: hemodialysis and peritoneal dialysis. Hemodialysis removes blood and filters waste and extra fluid and normalizes electrolyte and acid-base balance, and it may require up to 3 times a week. Peritoneal dialysis requires fluid to be replaced into the peritoneal cavity that circulates and allowed to drain, and this is more convenient because this can be done nightly at home. Now, two important physiological processes that we mentioned earlier are the renin-angiotensin-aldosterone system and its relationship with hypertension. Okay. To treat this, there are 3 classes of drugs are used to reduce blood pressure. These are ACE inhibitors. This is the angiotensin converting enzyme, which is produced from the liver, which converts angiotensin 1 to angiotensin 2. Angiotensin receptor blockers. This will block the receptors from angiotensin binding to it and having its effect. And also aldosterone antagonists, which will also reduce the hypertension from the reabsorption of sodium and the consequent water reabsorption. Okay, so you might have to review these if you're a little fuzzy on these. Hyperglycemia. Well, this is high blood glucose levels, more than 100 milligrams per deciliter, measured while fasting. Okay, Glycosuria is glucose in the urine. Remember, there should not be too much sugar in the urine, and this is commonly seen in diabetes mellitus, and it results when the transport maximum is exceeded due to too much glucose in the filtrate. Remember, transporters, there's only so many transporters present in a membrane, and so once they've saturated, you've reached the transport maximum. And so for these glucose transporters, if there's too much glucose, then of course they're going to find glucose in the urine. SIADH is syndrome of inappropriate ADH secretion. So you can get an idea what will happen here. It's hypersecretion of antidiuretic hormone. And as a result, you have excessive fluid retention leading to decreased plasma osmolarity and high urine osmolarity. Interstitial cystitis. This is inadequate mucus production by the urinary bladder mucosa. And of course, the mucosa is protecting the epithelial lining. And so this will allow acid and other toxic substances in the urine to damage the mucosa and tissues. Renal clearance. This is the rate at which kidneys remove a substance from blood, and so this is an excellent way to monitor the level of functioning of the kidney. In order to do this, you need to use a substance that is completely filtered, that is not every absorber secreted. And one of these substances is called inulin. And so inulin has been used to estimate glomerular filtration rate. And so this is just a short, very brief coverage of the major disorders and ailments of the urinary system.